This is TALK to KEDI Sharing knowledge, liberating mind. Hello there. Thank you so much for joining me on another edition of your number one educational online broadcast, TALK to KEDI. Our topic of today is cataract, the causes, symptoms, and treatment. In other words, in this edition, we'll be shedding light on cataract, what they have, why they happen, the early signs and symptoms to look out for. Also, we'll be sharing with us the prevention tips and also some possible solutions. My name is Felix Adedoyin. Welcome on board and get ready to learn. To do justice to today's program is to do justice to this important topic, so to say, is one of our senior lecturer. He is a seasoned TCM Consultant, and of course, he is the owner of Service Center 1021, located in Ibadan, Oyo State. For the very first time in the history of Talk to KEDI, please join me in giving a warm welcome to Mr. Majekodunmi Odebunmi, popularly known as Mr. Majek. You're welcome. Have a seat, sir. You're welcome to Talk to KEDI. All right, sir. Can you do us the honor of introducing yourself to our viewers and saying hello to them?
For our viewers watching at home, good afternoon to everybody. Trust we are all doing good. My name is Mr. Majekodunmi Odebunmi. I'm a consultant in KEDI Care and a service center owner, Service Center 1021 in Ibadan, Oyo State precisely. Thank you for having me.
You are welcome once again. Thank you for coming to the show for the very first time to share with us from your wealth of knowledge and experience. If you're tuning in for the first time, this is Talk to KEDI, your number one educational online broadcast, brought to you by KEDI Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and equipment nationwide. Welcome on board and stay tuned. Once again, our topic of today is cataract. We'll be talking about the causes of cataract, the symptoms, and the treatment. So without wasting our time, let's get right to our statistics. So, Mr. Majek, can you please read for us or share with us some of the cataract related statistics that you have?
Okay, thank you, viewers at home. The statistics that surrounds cataracts, ghosts, according to global information on national eye health, there are data submitted through World Health Organizations that says that guidance and national blindness convey a certain result in 2025, and such ghosts globally, an estimated 15.2 million individuals are blind due to cataracts. Wow. 78.8 million people live with moderate to severe visual impairment caused by the same thing called cataracts. In Nigeria, over 4.2 million people are living with blindness or visual impairments with cataracts, accounting for about 4.3% of blind cases and 45.3% of severe visual impairment, mostly in adults.
Wow, this is quite revealing for this amount of people to be living with cataract. Indeed, the show has started. So don't forget you can be part of the conversation in the comment section. Now is the perfect time for us to connect together, to relate together. Just click on the link in the comment section, share it with every of your friends and family. Invite them to come and learn about cataract, its causes, the symptoms, and the treatment. And peradventure, if you have any question whatsoever, now is the perfect time for you to start dropping in your question. Do not wait until our guest has gone. Then you'll be saying, you have this question to share with us. You need our guest expertise to give you his or her own contribution. So please and please, now is the set time. Start dropping in all your questions. Peradventure too, let's say you have had experience in treating cataract with one of your own clients or your patient, please feel free to share your experience with us. We are going to read through so that every other person too can also learn from you. Thank you once again. So over to Mr. Majekodunmi, Mr. Majek, as we are going to take us through cataract, the causes, the symptoms, and the treatment. I would like to start with my first question. My first question is three in one. So probably I would like to take it bit by bit. So I will start with the first one, which says, what exactly is cataract, or what exactly are cataracts?
Thank you so much.
Yes, sir.
Cataracts, so to say, has been around of age, and it is mostly the way our eye anatomy is. We have a lens which is made up of what we call protein and nearly water, and this particular lens, the purpose of it is to focus light on the retina part, so to say. So now it is very, very delicate, and so when the lens, the proteins around the lens start clumping together on that lens, thereby inhibit visual.
Yes.
Getting that you cannot see very well. Then we will say the person has what we call a cataract. So cataracts over time, once these settlements become a growth on that lens, now there will be loss of vision. And so that person is experiencing what we call cataract, and leads to blindness as well.
So which means it's when the lens becomes cloudy,
Exactly.
and then it reduces. There's a fog on that eye lens,
Exactly.
thereby blocking the visual.
Exactly.
You can no longer see clearly again as it were before. All right. So the other part is that how do this actually affect the human eye? How do this cataract affect the human eye? And then what are the main causes? Just run these two together.
Now, it's actually affect the human eyes over time because some people mistake it for aging. You understand? I think it's probably is age. And the common causes, before I go to the causes, we have types of cataracts, and some of them are caused by progenitor during birth, due to infection from the mother and person to the child. Some are caused by what we call corticosteroid, and so on. When you use too much of steroids, drugs, so it can be corresponding for this. The common ones are aging. You get it now. When you age, also oxidative stress, you understand, from free radicals, it can cause what we call eye problem. So the early signs people need to watch out for is what we call blurry vision. When you notice that sometimes when you try to see far and it becoming blurry, sometimes color starts fading off, or it becomes yellowish. Automatically, it's a sign of cataract. So the next thing is to go and seek medical attention.
Okay. Before we go to the early signs in particular, you're talking about the causes of diabetes, causes of cataracts, and you said aging is part of it. How about there is diabetes? Because I like diabetes also part of the causes of cataract because of the excess secretion of blood sugar. Thereby, when it becomes so much in the body, it affects our lens.
Exactly.
What other causes do you
Exactly. Just like you mentioned, the medical condition. Yes, diabetes is one of it. You understand, which is very, very important. Sometimes poor diet too also contributes to cataract. Yes. Wrong diet combination. Sometimes when you feed on food that are more of artificials than the naturals, it can lead to cataract. In the course of this, I'm going to be explaining some of the diet that we need to go on with prevention tips.
And also family history is also part of it, right?
Yes, family history cannot be ruled out, which is sometimes hereditary. It can be ruled out, so it is inherited from the parents. It's all of these things are part of what forms cataracts. The most important thing is this: what are the signs you are seeing? What are the symptoms you are seeing? Can you be able to interpret that this is cataract or not? Okay,
so that takes me to my second question, sir. So the second question is, what are the early signs and symptoms that people often overlook or mistake for normal aging? Like you said earlier, you said some people think it's aging, whereas these signs is signaling to cataract. So what are these signs? I know you have quite a few to share with us. Please let us know about it.
Okay, thank you, my host. Now, what are the things you need to watch out for when you want to check out for whether you have cataract or not? Number one is, I mentioned it, when you begin to notice that you're having a blurry vision,
Yes.
you understand me? Automatically, it's the symptoms of what? Cataract. So another thing is when you begin to see a fog light, you understand me? It is the symptoms of cataract. Likewise, when you are sensitive to light,
Excessive light.
excessive light,
Okay.
especially sometimes maybe ultraviolet ray, you are so sensitive to it. To tell you that you need to be careful because cataract is
Knocking at the door.
These things and so on are signs. Then when you begin to observe that sometimes they are fading, we are trying to see things and it fades off easily. Automatically, it's the symptoms of cataract. Thank you so much.
All right, thank you. So next, with this, having seen the signs and symptoms, and we can identify them with what you've said, with all in case one could not see clearly, and you start seeing that there is fog here and there. So we already, that person should be careful that possibly cataract is knocking around the door. So my next question is this question, my third question. It says, who is most at risk of developing cataract? And the other thing you say, you're going to tell us about some lifestyle changes too. So what lifestyle changes can help reduce it? First of all, you tell us who is at risk. You understand? Then next is how can it be reduced?
The truth is this: everybody is at risk of cataract. As it's just a simple truth. It's just that there are some categories. People from age of 60 years and above, they are mostly prone to having what we call a cataract. And so you need to be very careful. You need to watch out for some certain things, especially when you discover that there are some lifestyle that you are into, especially people that smokes a lot. When you smoke, automatically it leads to a lot of free radicals that can affect the liver,
Smoke,
and all these things can affect some organs that helps our eye. So you need to watch out for smoking. It's very, very important. And also, I always tell people to be very, very careful the way they expose themselves to ultraviolet.
So excessive ultraviolet rays.
It's not really advised. So when you know you are allergic to this, automatically you need to be careful, be aware of how you expose yourself to that. And also, sometimes I tell people that watch what you eat. I'm an advocate of good nutrition. You understand? Then with this, if you are not careful about what you eat, then there's everything you stand the chance to risk what we call cataracts and so many other factors.
Okay. With this risk factor, now you talk about excessive ultraviolet ray. I'd like to digress and ask you this question. You're talking about screen time, everything, exposure to lighting. How about in our generation nowadays now? Most of the time, is that you're on your phone or you are on your laptop, you're watching TV. We are almost facing the screen. Especially when we are on transit from one location to another, you are always on your phone or on any of our gadgets. So the question I want to ask is that does this type of exposure too also relate with cataract? Can we say it can also cause it? Screen time, phone usage, laptop pressing over and over again?
Definitely. They are all means of exposing yourself to what we call ultraviolet rays of light, especially what we call radiation. Once you expose yourself to too much of illumination directly from phones, laptops, this includes the nerves of the eyes, and it weakens the lens, and it's one of the reasons why the proteins around that lens easily broke down, come together, and form a settlement on the lens. So, of course, I'm an advocate of people that tell them that please reduce your screen time on phones, especially sometimes at night. If you must use your phone or laptops at night, ensure there are a little bit of illuminations. So that will have diffuse with the radiation coming from the phone directly to your eyes. Other conditions like medical conditions are also there, like we said earlier on. we need to understand how to manage our blood glucose level. This is very, very important. You need to put this in check and watch the kind of food you eat that can lead to what we call high blood sugar.
Okay. So, all right, I would like to talk more on this particular one that we just talked about, this phone issue. You know, light from the phones, they cause what is called digital eye strain.
Yes.
And at the end of the day, you will discover that someone will start having eye fatigue, dry eye, headache, blurry vision. Sometimes it will even result to neck and shoulder pain.
Yes.
So, like you said, it is actually similar, but it is not totally decided or said that, okay, fine, exposure to this phone light majorly actually cause it, but it's a pointer that it could cause it. So, but there is difference between them. But the most severe, like he said, the most severe is exposure to ultraviolet ray. There is difference between ultraviolet ray and the ray from this phone, our screens, and those ones are called blue light. The one from our phones, our laptop, our screens,
which mostly contribute to what we call radiation.
Radiation, exactly. Once all this ray keeps coming to our eye, it does really affect. So, like our guest rightly says, we need to be careful. We need to be watchful of all this exposure, as they might in turn affect our eye even as we age. Thank you so much, sir. So, like you were saying about that, you are an advocate of good nutrition. So, I would like to take you on that, and that will lead me to my next topic, my fourth question, which says that, are there specific food that can help prevent or slow down cataracts, that can slow the progression, the growth of cataracts? And if there are specific food, please list those foods for us, and then kindly state some prevention tips that you and I and every other persons under the sound of our voice who are listening or watching or from anywhere in the world can employ in order to have a good daily eye care.
Okay. Thank you so much, your host. For viewers out there watching this, for you to prevent yourself from having cataracts, you need to understand that there are some food or nutrition advice you need to go on. First, any food that is rich in antioxidants is very, very good for you. Okay, any food rich in antioxidants, they are very, very good. Like most of these are strawberries, they are very, very good. Avocado is very, very good. Fruits, spinach, yes, okay, it's very, very good. Well, to some of us, in our Nigerian delicacies, if you can form the habit of going for ugu, our so-called green leaves. Green leaves.
All those are veggies.
They are very, very good. They are rich in antioxidants, so it helps in preventing our eyes from getting what we call cataract. Also, any fruit rich in vitamin C.
Yes, thank you.
Very, very good.
Vitamin C.
Vitamin C is very, very good. You can be gotten from this citrus food.
Yes.
They are very, very good. Once you are taking them in moderacy, you prevent yourself from getting what we call cataract. And also, omega-3 fatty acids. Foods rich in omega-3 fatty acids like salmon fish and the likes of them. The consumption of these on a daily basis helps prevent our eyes from getting what we call cataract. So when we talk about tips that we need to invite in,
prevention tips, exactly,
ourselves from getting cataract. Number one, I want our viewers to practice this, what I call 20-20-20 rules. It's very, very important. So how do you need to apply this? You take 20 minutes, the time out, then look straight for 20 feet ahead for 20 seconds to an object. This will prevent your eyes from getting strained. Because once the eye gets strained, automatically it weakens our lens.
All the lens,
so
exactly.
20-20-20 rule is very, very important. I repeat again, take 20 minutes out from whatever you are doing, look at something object from 20 feet away for 20 seconds. So doing this at a point in time, it helps to reduce strains of your eyes. And also in our diets, I want to encourage our viewers, please ensure when you prepare your vegetables, the reason why we advocate for palm oil is basically because of consumption. And really, groundnut oil is not that bad too, but basically reduce the intake of what we call fried foods because they are not friendly to the liver, and liver and kidneys helps our eye health. I think that's the truth. Thank you so much for that.
All right, okay. I would also like to add to the prevention tips with my own little knowledge. Like he said earlier, we should practice the 20-20-20 rule, which is to be done every day. Every day of our life, we must do it. After 20 minutes of screen time or just focusing on a particular thing, take 20 minutes, that break. After 30 minutes, take it away. Look at something 20 feet ahead of you, an object or just anything whatsoever. Just focus on that thing, just for 20 seconds. It's not more than 20 seconds. After 20 seconds, relax. Once the 20 minutes is over, go back to what you're doing. Maintain this every day. And I'll also say we should also engage in a regular eye check. Indeed, in Nigeria, we hardly check our eye because once people see it as an insult. When you say anything to them, it's like, can't you see? It will be like an insult. But whereas you are trying to educate them or to let them know what is happening around them or for them to see what they ought to have seen. So regular eye check is quite important and sacrosanct for everybody. Feel free to walk into any optician office and request to check your eye. Check your status of your eye, see how good your eye is. Most of us are always like, my eye is very good, I can see this, I can see that. At the end of the day, it will end up becoming that the eye is very bad. And also, I
want to chip in this also for people who are always exposed to ultraviolet rays due to probably one thing or the other. I want to advise that you wear a sunshade.
Thank you.
Very, very important. You go to developed countries, whenever they go to beaches or they are out there, sunshade. It is not for fashion.
Exactly. I was about to say that too. And you are saying we should always wear sunglasses, always wear sunshade anytime you're going out. And you know it is a very sunny. Look at Nigeria, for instance, now. God has blessed us so much that there are particular times that it is very, very sunny. So each time you go out, ensure to wear a sunglass, ensure to wear a sunshade, and also ensure that you maintain a good blood sugar. Like we are talking about people that have diabetes. But if you have a good blood sugar level, then you will not be diabetic. You understand? And however, even if you are diabetic, you can still maintain it. But the thing is, diabetes is one of the cause that actually increase the rate of cataracts. But before it gets to that level, ensure to have a good blood sugar. Watch your blood sugar at all times. And also, avoid smoking. For smokers, like you talk about smokers the other times.
Dangerous.
It's very, very dangerous to the health. So please avoid smoking and also reduce alcohol intake. For those who consume alcohol regularly, some people are turned into water. Without it, they can't survive. Every blessed day, they must take 2 or 3 or 4 bottles as well. Such an individual must avoid alcohol intake because like Mr. Majek said, it damages the liver. And the liver and the kidney, they are very, very responsive. They are part of the organ that is very, very responsive to our high health. So we need to be very, very careful about this. Once we observe all these tips that we have shared from the 20-20-20 rule down to you engaging in regular eye check, wearing of sunglasses, reduce exposure to ultraviolet ray, and also avoid smoking and go. Before you know it, you have a good eye till your old age. Thank you once again, sir, for sharing this tip with us. And that takes me to my next question, sir. Having seen, even with all these cases happening around us, the statistics that we read, the tips giving, the courses, you know, some people still might not even still understand how or when exactly they ought to visit the doctor or visit the. So I want to ask, at what point should someone that is experiencing all the symptoms that you listed earlier, that you shared with us earlier, at what point should such an individual seek medical attention, and also what treatment options are available for any person that is currently dealing with cataracts?
All right, thank you, my hosts. For viewers out there, I'm going to say it again for this time that if you know that you are experiencing any signs and symptoms earlier mentioned,
maybe you should relate the signs and symptoms, because some people are just joining us.
Yes, blurry vision. You are seeing that you are not seeing clearly again. One, color becomes yellowish or faded. Are you getting now? Most of these things, once you discover them, I want to advise you visit your eye professional, which is ophthalmologist, right?
Yes,
visit them, let them consult a thorough eye check. Now, if you are having cataract, if it has grown, it's not the end of life.
Yes.
There's always a solution. So we always advise that you go for surgery. Surgery is advised, and it's one of the fastest and simplest way, painless even, to the lens that is clogged with cataract will simply be removed with another lens, and you see clearly. Those are the options. Then please, if you know you are having diabetes, put this in check always. Check your blood sugar. If you smoke, please quit smoking. There's one thing about abstinence or reduce. We are not asking you to reduce here. I want to encourage you to quit smoking completely. Alcohol intake is dangerous, like you mentioned earlier on, to our liver. It's not good. And like we said, liver and our kidney helps our eye health. And so, because if the kidney doesn't filter enough blood, doesn't supply enough blood, the eye nerves and tissues will not be able to function very well. So please ensure you drink enough fluid and make sure you observe what we call total hygiene. Total hygiene is even the way we eat. You don't just consume things anyhow. Consume things in moderacy. When you get to the age of 50 and above, I want to add this: is reduce intake of any food that is high in sugar. Reduce it. Reduce any fatty foods from age of 60, 50 even above. Reduce it. Be more on naturals. There are these things that says that if nature don't make it, please don't take it. It's very
if nature don't make it, please don't take it.
It's very, very important. Go natural mostly, and make sure you drink water and observe rest. It's very, very important. Most of us that experience eye problem, when you check too much, we don't give time to rest.
To rest the eye. The eye is already strained, it's already stressed.
So all these things can lead to the breaking or wearing away of the lens. Thank you so much.
Thank you. I would like to also add, although he said when you're at the age of 50 and above, however, and he said the solution to this is with surgery. But I would like to add again, even though before it gets to surgery, once there is early detection, the moment you start seeing this, before it gets to surgery, it must have worsened. The case must have worsened. That's why it gets to surgery. But before it gets to surgery, once it is detected early, there is still solution for you. There is still solution for you. There are things that will be given to you to ensure that it helps to improve the lightning that comes to your eye. And also, glasses will be given to you. That will be recommended glasses that will help to adjust the flow, the ray of light that comes to such an individual's eye. Except the worst case, that's where it will lead to the final stage that Mr. Majek said, which is about surgery. So please don't give up. There is still solution for you. Don't give up. Maintain everything, and you can still enjoy your eyesight. Thank you so much. So with this, I'm going to my last question, sir. And I know that you are a renowned KEDI consultant. You have been in this business for many, many years. You have so many words of knowledge in traditional Chinese medicine. So I'd like to take you up with this, sir. Which KEDI products would you recommend from your own experience, from people you have dealt with, you have assigned, you have treated in this, from your own wealth of experience, sir, which KEDI product would you recommend for someone that is living with cataracts? And once you tell us this product, kindly share with us the dosage rate and the treatment rate, like how effective has it been ever since you have been prescribing these KEDI products to people, or maybe you have any testimony to share with us. This is the time.
Thank you, viewers at home. As a KEDI consultant with vast knowledge and experience, I'd like to tell viewers watching this program that KEDI products are there to help relieve the side effects of cataracts and also for overall well-being. So for eye health, especially people with cataract symptoms, I want to encourage us to go for our eye better. Also, we need to observe, like I told you earlier on, two organs function very well for the wellness of our eyes, liver and the kidney. And so I want to encourage us to go for our gastric fort. It's very, very good. Lyrich, they are very, very good. So when you want to treat cataract of any eye problem of such, first detoxify the system with our gastric forts. Then our red sheet, yes, it's very, very important. Of course, with our colon cleanser, when you have indigestion, it dents on our liver.
Yes, it gives the liver excess
workload. And as such, doesn't build up, not allow the liver to discharge its task. So, and also ensure you take colon cleanser, like I said. Now, after detoxifying with colon cleanser and gastric fort, main treatments to prevent cataracts, our eye better, because it contains blueberry, of course,
exactly,
and it contains what's it called, the chamomile for refresh tea. Yes, refresh tea is also part of it, and they are very, very good combination. So the way I treat my clients to get testimony, I detoxify, I treat, and I nourish. So for the detoxification product, like I mentioned, we need colon cleanser, we need gastric fort and red sheet. Now for the main treatment, you get our eye better. You get our hemocare. Very, very good. Hemocare purify the liver, the kidney, and supply rich blood to the eye for the eye to function better. Now also our our refresh tea because of the chamomile. And for the nourishment, we need our ultra mega fantastic product because it contains essential omega-3 fatty acid. It's very, very good. And make sure you go on fresh fruits and vegetables that are rich in antioxidants and are the one that contain lutein, which is our spinach. And also, egg is not bad. Egg is also good for our eye health.
So this is how you treat them. So please, can you also do us the honor of telling us the dosage? You already said for the detoxification stage, these are the products you use. What are the dosage? And then to the treatment and the nourishment.
Now, thank you so much for that question. As a Chinese health consultant, anything that has to do with herbal medicine, so to say, TCM is traditional Chinese medicine, any herbs needs to be taken on empty stomach. And as such, if you are taking our detoxification products, gastric fort, 3 capsules with warm water, 1 hour before food, I encourage people to take our colon cleanser team either first thing in the morning or preferably 2 hours after dinner. It helps, any salty build up, hangover, it's removed from the system. It's very, very important. While our eye better is basically 2 capsules twice daily. That is our eye better. Ultra mega is a food supplement. Supplements are best advised to take during or after meal. So 1 per day is good to go. Lyrich, 2 capsules per day is okay for general maintenance. And our refresh tea, boil, sip it along the line. Probably 30 minutes, an hour or 2 hours. It's very, very good. It will reduce the effect of radiation in the system. Thank you so much.
All right, thank you, Mr. Majek. Indeed, you have heard it all from our very own Mr. Majekodunmi Odebunmi. So right now, let me take a pause. Let's pause a while and read through our questions and comments in the comment section on our page. I will start with our Instagram handle. I have here from Toke, and it says, "Are cataracts a function of gender? Is it gender based?" This is not whether it is gender bias or this.
It is not gender, but it is not gender based. Cataract occurs to both male and female. That's it.
All right, cataract occurs to everybody. Mrs. Toke, please, cataract is for everybody. It's not gender bias, whatever. And also, I also have here from Facebook, from Clayman from Facebook, he says, "Are there foods that cause cataracts?" Initially, you were telling us about food to feed on, but are there particular food so that we can know what to run away from?
Now, I want to say this: if you eat too much of food that are loaded with too much of flour, so to say, yes, too much of flour foods, they are not edible for our body, and also it can affect. When you take too much of fried food, it can affect our eyes. Yes, when you take too much of artificial food, especially the way people prepare food these days, you see, it's not really advised. Actually, honestly speaking, when you take too much of artificial food, it's not good. Well, junks, they are not too good. Any food that can affect our liver, too much of rice is not advised. It's not advised. It can affect our eyes. So please watch out for this and make sure you don't take, like I said, don't take too much of food rich with artificial
all these artificial preservatives, like all these
Then-
canned foods.
Exactly. They are not good at all.
What about someone like me that likes to take Titus? That's canned Titus.
Well, I can tell you, like I still maintain, if nature don't mix it, please don't take it. I'm not saying you shouldn't take canned food, but let it be in moderacy.
Okay.
You understand me? Let it be in moderacy. People that take too much of acidic content caffeine is not healthy for our eyes. Thank you so much.
Thank you so much. Let me take the next question. Also from the same person, claimant on our Facebook page, still asking, can cataract lead to total blindness?
Absolutely yes. If not properly taken care of at the early stage, if it's not being treated, it can lead to total blindness. So that's just a simple answer to that.
It's just a very simple answer. The answer is yes, Mr. Clayman. And next on our Facebook page from Mr. Mohammed Mikai, he says, "Are cataracts curable with KEDI products?" I think you said it earlier, so please kindly rephrase again.
Any stage of cataracts can be treated with KEDI products. However, if it has become chronic, that it has gone to the last stage, I advise surgery. However, there are post-surgery products and pre-surgery products that you can take. You understand that when you take your refresh tea, you take our eye beta and MOK. Therefore, post or pre-surgery products, it helps gain the cyber. The bottom line is you want to have your cyber.
Exactly. That's just the bottom line.
So KEDI product is there for you. So once you know that the cataract has grown to a certain stage, go for the operation, then bank on KEDI products and some other advice from your ophthalmologist. Thank you so much.
Thank you so much. If you're just tuning in, this is Talk to KEDI. And our guest, Mr. Majekodunmi Odebunmi, he has exhaustively discussed with us cataracts, what they are, their causes, the symptoms, and the treatment. So thank you so much for tuning in. Right now, it's time for us to take our Dr. Cap HT for this edition of Talk to KEDI. So, Mr. Majek, please kindly do us the honor of reading out the Dr. Cap HT.
All right, Dr. Cap has these tips for every viewer watching this video. Your eyes are priceless.
Yes, sir.
Don't ignore blurry visions, glare, or difficulty seeing at night. You get that? Early eye checks can detect cataracts on time. And with simple lifestyle habits, which of course I've mentioned before, and professional care from professionals, vision loss can be prevented when you practice all this. Also, protect your sight today so you can enjoy a brighter tomorrow.
Yes, I will take it up from there. It says, "Well, protect your sight today, so you can enjoy a brighter tomorrow." With that is a wrap on this edition of Talk to KEDI. I hope you have learned something valuable today about cataract, its causes, symptoms, and treatment. Special thanks to our wonderful guest, Mr. Majekodunmi Odebunmi, popularly known as Mr. Majek, for taking time to, one and only Majek, for taking time out to share with us from his wealth of knowledge. In case you join this broadcast late, don't worry, don't fidget. This entire video will be available on our Facebook page at Kedi Healthcare Industries. It's also be on our Instagram handle at Kedi Healthcare _official. It's also going to be on our YouTube channel at Kedi Healthcare. You can also log into our mobile application, Kedi Care App. You will see the full video and even the videos of all other editions of Talk to Kedi is right on all these channels. Feel free to watch and share with your loved ones. Don't forget to join us in the next edition of Talk to Kedi because it promises to be insightful. Thank you so much for tuning in for to Talk to Kedi. Until I come your way next time, I am Felix Adedoyin. Bye for now.